Are you having abnormal vaginal bleeding? So in this video, I talk about some of the things your body is trying to communicate every time you have that bleeding that is not normal. Why am I calling it the bleeding that is not normal? We all know for every female, we have this normal bleeding, which we usually call menstruation, which starts from the time we start our puberty. That's usually around 13 to 15 years and goes on till menopause, yeah? The time when this stops. Usually it's about 50 years, yeah? So throughout this whole time in between here, we have these menses happening regularly. So, and usually they are supposed to take a particular duration. For example, every month you should be menstruating for less than 80 days. Anything more than 8 days, it's an alarm that your body is communicating. That's abnormal. You need to look out for that. Then it's supposed to happen every month, as long as you're not pregnant. Yes, or as long as, yeah, usually as long as you're not pregnant, it should be happening every month. So if yours is not regular, there is something. Your body is communicating something. Then thirdly, it should be of a certain volume. Ideally, if we are to change pads, for example, in a day, if you're to fill that pad to like 2/3, we expect that you change like 3 times. Yeah, of course you can change as many times as you want depending on your convenience. But if you're to assume you filled it to 2/3, 2/3 of that pad has got filled, you're supposed to change a maximum of 3 times. If it's filled and you're changing like 8 times, that is a very big alarm sign. That's abnormal. Then the other thing, so we've seen regularity, we've seen the duration, how many days you're spending in, we've seen the volume. Then the other thing, it should start at puberty. You know, you could be 25 years and you've never had menses. Or you could be 17 and you've never had menstruation. That's abnormal still. Or you could be menopause came, this menstruation stops, and then all of a sudden at 60, the bleeding resumes. That's a very big alarm sign. Your body is communicating something. Kindly do not ignore that. And now we want to know, if I'm heavily bleeding, I'm using 5 pads, I'm using 8 pads, what do I do? Because clearly that's abnormal. If I'm missing some months, I'll go in Jan, repeat my menstruation in May, what is that? If I'm spending in more than 8 days, what is this trying to say? If it's, of course here we are assuming you're not pregnant. We are not talking about people who are pregnant. We're talking about non-pregnant females in their reproductive age who are having an issue with abnormal vaginal bleeding. So here is what your body is trying to communicate. 1, your body is telling you that within your system, you see our system here. It has the vulva out here, the vaginal canal, the cervix, then the uterus that carries our baby, the tubes, and then the ovaries. So it's telling you that this bleeding, first of all, is coming from in here. Usually it's because there is something, a growth, something abnormal that has grown within your system that is bleeding. Yeah? Or it's some other thing. If it's not a growth, it's some other things in your blood that we shall have to talk about. So these are the 4 things you look out for, or the 4 things that are most likely the reason why you're abnormally bleeding. These are the 4 growths that could be happening in your body and are the reason why you're bleeding. 1, it could be a growth which we call a polyp. These are not cancers. It just grows and easily bleeds. Every after sexual intercourse, in case maybe there is an examination, in case of douching, this growth will bleed. Usually if you go to hospital, there is a way to manage it, and usually it goes, it doesn't recur. That could be one of the reasons why you're bleeding. The second growth that can make you bleed, usually it's what we call adenomyosis. This is not necessarily a growth. Usually it's something whereby you see that lining within your uterus. Usually there is a lining which keeps shedding every time you have menstruation. So if this lining grows too deep to involve some of the walls, you know, the deep muscles within your uterus, it makes, like when the bleeding happens, the shedding is so deep in that it tampers with the blood vessels and then you bleed heavily. So if you're having heavy flow, it could be this. Get to your gynecologist, get checked. If it's confirmed, it's usually there is a way to manage it. Then usually also it comes with a lot of pain because it being deep, it tampers with a lot of things. So that heavy bleeding, yeah. The polyp, we said for it will make you most likely bleed at times when you don't expect your menses. Like all of a sudden in the middle of the month, you start bleeding when you didn't expect to be bleeding at that time. You get within a month, we expect that you menstruate once. But if you're bleeding like 3 different times within the same month, there is an issue there. You get most likely the other polyps. Yeah? The fourth growth that will make you bleed are what we call fibroids. If you have fibroids, even them, they will make you have those bleeds. You finish with your menses, but you're bleeding. It could be fibroids. Your body is communicating. You're not supposed to be bleeding after menstruation. So go get assessed. If it's them, they are managed. You get. There is always a way to manage all these things. The fourth growth, which is the most dangerous, usually fearful, is what we call malignancy or cancer. Cancer can make you start getting abnormal bleeding. This cancer can be cancer to any of these parts. It can be cancer of the vulva, it can be cancer of the vagina, it can be cancer of the cervix, it can be cancer of the endometrium, the lining, which usually sheds during menstruation. It can be cancer in any of these regions, and usually it also its alarm signs is bleeding. So if you're bleeding, your body could be telling you there's something not right going on. It can be a cancer. Go get assessed. If it's so, it's managed as early as possible. Most especially if you're bleeding after menopause. You know, as females, as we advance in age, as we grow, yeah, we reach menopause, as we move towards our later ages, 60, 70, like the likelihood of developing cancers is so high, most especially endometrial cancer you get. So you're bleeding, yet you finished, you clocked your menopause some time back, and now you're seeing bleed. Usually that's a very big alarm sign for endometrial cancer. You go get assessed, then, and such that we make sure it's not that, yeah? We all know that cancer is best treated when it's found out early. We don't want it to delay and spread to multiple parts of the body, and then now it becomes a bit complex to manage. Yeah. So those are the 4 growths that could be happening in your body if you're bleeding. You just need to go get assessed, and then if it's any of those, it's managed. Then in some other scenarios, you're bleeding when it's actually not anything like that. There is no cancer, there is no fibroid, there is no what we call adenomyosis, there are no polyps. Like it's none of those. So what is it? It shows you that now this time round, you could be bleeding because of some other abnormalities that can only be detected in blood. You get, yeah. So if none of these, you've been assessed everywhere, these things are not there, you could be having a bleeding disorder in the family. There are some families which have things like hemophilia. These are diseases whereby even when you get a cut and then you're bleeding, your blood doesn't clot or doesn't stop easily. Like it goes on to bleed endlessly without stopping. So there are those people with hemophilia. It could be one of the, because even menstruation involves, if you're having menses, you're taking more than 8 days, you're heavily bleeding, it could be a bleeding disorder in your family. And this is best seen in when we've just started early here at puberty. You have a young girl, a daughter, or you're that person. You could be young and you're watching this video. You're that person, you've just started your menses, but you're taking like 10 days in. You're changing pad like 5 times or 10 times in a day. You're using a full packet in one day. You could be having a bleeding disorder, yeah, which needs to be checked and treated. So that could be another thing your body is communicating. You get. Then don't take those drugs that stop the bleeding. Yeah, you may take them, but even if you're to take them, make sure you find out what is causing it. Such as the cause, we all know that, like a tree, for you to fully demolish a tree is by removing the roots. So even as fully removing this issue of bleeding, you can't demolish a tree by picking off the leaves. So when you're stopping the bleeding, it's like cutting off leaves and assuming the tree will fall. No, you have to remove the root cause. So even here, you have to check what is causing this, and then you sort it, you get. So other than bleeding disorders, it could be hormonal issues, you get. Usually what we call ovulatory dysfunction. Yeah? Here what are we trying to mean? You see what we saw in our system, the ovaries. They give us some hormones, multiple hormones that help to make sure that we menstruate every month. There are multiple hormones. There's a way they appear in certain levels at certain times in a certain way and make sure that that lining sheds every month. So in case there is any imbalance in there, yeah, the hormones don't rhyme well the way they are supposed to do naturally, you start getting abnormal bleeding. You'll start missing some months, you start heavily bleeding or not bleeding at all, you get. And usually this is common with contraceptives. There's no contraceptive use. Contraceptives basically play around with hormones. So that is one of their side effects. If you're on any contraceptive, oral pills, yeah, implants, all those are contraceptives. These injections, so you're most likely going to face that. If you have a contraceptive, it's normal. If you have no contraception and you're experiencing this, you need to go and then it's sorted. It shows your hormones are not rhyming the way they're supposed to rhyme naturally. You get. Then the other thing that could be the reason why you're bleeding abnormally, it could be because there are some things which we put in hospital, some IUDs, yeah, that will make you bleed for some time before your body gets used, like the hormonal IUDs. So if you just had the hormonal IUD and you're bleeding, that's expected. Yeah, I wouldn't call that abnormal. It's kind of expected. Yeah, it's like a side effect to that. Yes. So basically, those are some of the things. Always our bodies make alarms for us, and we are supposed to respond. Yeah, it can be any of those three, and we've seen the reasons why we need urgency. Urgency, visit a facility as soon as possible. And one of the reasons why we want them, it stopped. You see this bleeding, if it's too much, for example, if it's heavy bleeding, you can, it's very possible that you lose a lot of blood to a point that blood now is too low in your body and you start getting very dizzy, very weak. You can even faint if blood goes below a certain level. So that's why we like it that you visit a facility, the bleeding is stopped. If it's too low, the blood is replaced. Then the root cause is investigated, and once it's confirmed, it's sorted. By the way, even if it's a contraceptive, if you're overly bleeding, you need to visit a facility such that it's revised. Your body could be less tolerant to a particular contraceptive. You don't bear until a point when you're severely anemic, like you've lost too much blood to a point that you faint. No, we don't want that. Usually, you notice it, communicate with your gynecologist or with your health, whoever handled you, such that they are able to revise the intervention. Yeah, so basically, that is it. Don't ignore the signs, visit the health facility, have the problem sorted. Thank you.